Hi, and welcome to Spruce. Spruce is a modern way to communicate with your clients and your colleagues. In fact, thousands of mental health clinicians across the country use Spruce to securely communicate with internal teams and clients alike. We believe that your communication platform should keep up with today's rapidly changing communication preferences and should efficiently manage your business. That's why we created Spruce. As a tool for healthcare communication, we also built Spruce with the highest security protocols in mind. So it goes without saying that the platform can be used in a HIPAA-compliant manner. What's different about Spruce is that it enables you to manage your client communication within one secure and user-friendly tool, and all communication and collaboration through Spruce can be accessed on a mobile app, computer, or iPad. Calls, voicemails, SMS messaging, secure messages, fax, video, and payments are all supported. Spruce partners with mental health practitioners just like you across the country to set a higher bar for the pace and quality of communication between you, scaling staff, and a growing client base. In fact, we've seen exponential growth that is 100% attributed to fast, responsive communications that were often lacking before. If you're missing calls while in session or unable to respond to every voice message that comes in, it may be time to consider moving to a solution that routes phone calls to specific members of your team, your intake coordinator, virtual assistant, a phone tree, or even that converts to SMS if no one's available to answer. After all, connecting with clients is the backbone of your business. And in the Spruce platform, all of your communication is sorted by client, which means that regardless of how they like to communicate, whether that's via text or traditional calls, all your communication with that person can be seen in one place and is automatically documented. Plus, you can use Spruce on your phone or your computer, which makes it easy to run your business wherever you are. If you have a group practice, when you integrate Spruce, coordinating care with teammates and even other clinics has never been easier. Everything is customized based on your unique practice needs. You can ping a teammate with a task or a question, start a secure conversation, or write a note that only you and your team can see. And if your entire team is using Spruce, you may choose to have everything unified in one inbox to share or divide your communication by phone number, clinician, channel, or inquiry. Some of our most popular communication tools include a business phone line, fax, texting, and telehealth capabilities. Let's dig in and start with phone and fax. As a busy practitioner, you don't have the time to answer every incoming call, and your clients don't want to have to call back several times to reschedule an appointment. Spruce enables you to maintain a HIPAA-compliant business phone line right on your personal cell phone or routed to a Spruce VoIP desk phone. This means that you can use one phone, but keep all personal and professional communication separate and compliant. Spruce enables you to minimize phone tag and ultimately decrease the volume of phone interactions that you face every single day by leveraging a mix of channels and solutions based on your schedule, your client's preferences, and your availability. If you're interested in a more advanced phone setup, you can create a Spruce phone tree and route callers to specific extensions, even to phone numbers outside of Spruce, like a virtual assistant, an answering service, or a hotline. Spruce enables you to create direct lines for each clinician or set up extensions for each clinician off of the main line. You can build Spruce for your custom needs. And whichever model you choose, all of your contacts, messages, call logs, and voicemails will be stored within Spruce. Voicemails are automatically and securely transcribed, which makes it easy to triage messages at a glance. If you have an existing business number, you can keep that same number and transfer it over to Spruce, or we can provide you with a brand new number in your area code. During the transfer, or what we call the porting process, you won't lose any phone functionality or connection to your clients. And once complete, you can cancel your other service. With Spruce eFax, just like with phone numbers, we can move an existing fax number in or get you a new one. All faxes are stored in electronic form within the Spruce app in a HIPAA-compliant manner, making everything from insurance verification to receiving client history a breeze. Send and receive faxes right from your mobile Spruce app or log in on your computer. It's whatever you prefer. No more clunky fax machines or having to print out documents. For mental health clinicians, leaning on a channel like texting to connect with busy clients dramatically reduces phone tag and the volume of phone interactions that you face every day. From Spruce, you can message clients in two ways. You can send standard SMS text messages to the client if that's their preference. On your end, you would still use the Spruce app, but on the client's end, it would look like they're just getting a normal text message to their phone. No app needed for them. Alternatively, you can invite clients to download the Spruce Patient app on their mobile phone or have them sign up on their computer. All messages are inherently secure and HIPAA compliant, and the app is completely free for your clients. That said, clients don't need the app to call or SMS text you. Spruce also supports secure group messaging should you have a client and their caretaker or parent, or perhaps a couple. You can now support them securely in one easy-to-view thread for everyone. Spruce also offers a range of internal tools that enable you to get things done faster. For example, you can set up automatic replies, which set expectations around when you'll get back to clients. Save commonly sent messages as templates or saved messages so you don't have to waste time typing the same thing over and over. Our mental health population save messages to relay upcoming appointment details, share links to important clinical information, and provide valuable booking and hours of operation information to clients without missing a beat. Even create out-of-office responders, alerts for urgent calls and/or messages, and schedule messages to be sent at a day or time in the future, such as checking in after a session or even reminding yourself to do something. Spruce enables you to create teams, such as billing or intake teams, so that you can set up automation through your phone tree and assign certain calls or messages to the right team or individual. Using Spruce Assignment helps you to divide and conquer all the work while making sure that nothing gets left behind. And if you're working from a group inbox with one phone number, you can easily assign conversations to yourself so that no one else gets notified. Spruce enables you to meet your patients where they are with virtual telehealth options. You can connect with your patients live via HIPAA-compliant video calls. You or your team can initiate a video call with a client, and they can accept your incoming video call when they are logged into their Spruce patient account on the mobile app, iPad app, or the web. To ensure that clients are prepared at the time of your video call, we recommend scheduling the visit with your client in advance, then sending a message a few minutes prior to the appointment asking the patient to open the Spruce app or log into their computer. Another great way to connect with clients is by sending them asynchronous, store and forward, clinical questionnaires known as Spruce Visits. Spruce Visits are adaptive questionnaires developed by the Spruce Health medical team that can be used for health assessments such as the PHQ-9, remote management of routine conditions, and follow-up. Your clients complete the questionnaires in the Spruce mobile app. Questions branch based on previous answers, so clients are only asked relevant questions. Their responses are sent back to you in Spruce, where you can review and respond to them. The Spruce app is full of additional benefits, such as our bulk messaging, inbox filters, assignment, contact groups, and more. But we wanted to just spend a few minutes today giving you the main points to get started. We're confident that you'll discover our other tools while using the product. We invest our energy into features that enable you to do your job better and to make Spruce your all-in-one communication solution. Spruce is the leader in healthcare communication, but don't just take our word for it. Take a look at what other customers have shared and what was gleaned from a recent webinar with renowned therapist, group practice owner, and podcaster, John Clark. We are built for mental health providers and are always optimizing the platform to suit the needs of the 80% of our customers that fall into your field. We're excited to welcome you and your business to Spruce. If you haven't already, the best way to get started is to begin your free trial. You can download the Spruce app by searching for Spruce in your phone's app store or by creating a trial account on sprucehealth.com. You may also reach out to sales@sprucehealth.com to obtain more information. If you already have the trial, just message us in-app and we'll help you with any questions that you may have.